In part 3, we will discuss other uses of IT applications in healthcare. In this part, we will look at just different aspects of how information technology is used in certain aspects of healthcare. They may not seem related, but they all do a certain function to make healthcare delivery more effective and efficient. Enterprise data warehouses. These are systems, these are organizations that help make strategic decisions. What does that mean? These are organizations, so this is a system that takes data, that takes information from medical reports, medical charts, and try to quantify them, get them into a numerical system. So say a physician comes up with a diagnosis with a certain plan, how do you use that information? How do you code that information? And see how that information could be done to either evaluate certain plans, evaluate certain organization, evaluate the process. This is important because that gives associations, that gives organizations to improve on what they are doing. This was also used by Veterans Affairs to try to use this system to improve, maintain their systems, and this is widely used when it comes to comparing different data, comparing different systems within the healthcare system. So then we also have radio frequency identification. These are the RFID chips. These are used almost everywhere, not only in healthcare, but in healthcare it's used for certain functions. These chips is uniquely identified by signal indicator where they are located. So Walmart, one of the first retailers to use RFID technology to manage its massive inventory. RFID tags can be used to track pharmaceuticals as they are shipped from a manufacturer to a customer, or they could be used to track costly medical equipment and identify providers in hospital to ensure efficient or effective care. RFID tags could also be used to identify laboratory samples to reduce medical error, track patients, including infants, while they're in the hospital, and also to track hazardous material as they are disposed, as they can pose a threat to the public. So now we'll also get into some of these applied health information technology and how they interface between the software or interface between the abstract to some practical applications. FreeSIA Pad is also just a wireless device, just like a notepad or an iPad, something like that device that was made to help physicians interact or integrate with the electronic medical record systems and interface even with the patients. They could take them with them when they went to see their patients, take information down, note things down. So just like an iPad. So these FreeSIA manages over 70 million patients annually. They could be in the settings of clinics, hospitals, do different surveys, obtain different information, and also they are able to help physicians interface with the patient and also the electronic medical record system. This, as I mentioned, is more like using an iPad, but more of a controlled way where the HIPAA laws are being abided by, and just ways to try to manage that. Then we also have Patient Point. This is like an endpoint device that would provide education to patients electronically while they are in the waiting room or exam room, just to educate the patient about the process, maybe to be able to interact with the patients, and even be another interface to try to help with the education aspect that physicians might have to do. So there are many partnering organizations that use Patient Point and many programs that are involving physicians, hospitals that may use this type of IT devices. Then we also have other optical scanners. One of the examples is Mera Find, like certain scanners that could be used even aiding in medical decision making In this particular one, it's looking for melanomas or skin, different abnormalities on the skin. So it can help aid the physician in making a decision whether they want to order a biopsy or not, and even giving some guidance in this process. By using these technology, it could help eliminate unwanted costs, unwanted procedures that may otherwise incur. Then we also have robotic checkups. So these are different robotic devices that can make rounds, that can go check on patients in different rooms, that could have an interface to communicate with patients, or even be in a way where physicians can communicate with the patients in a remote location. There could be two-way video screening, and these could be used to evaluate cases when it comes to patient conditions, evolving conditions, and even make certain decisions and also address medical emergencies that are there. Then we also have portable ultrasound machines. So these portable ultrasound machines avoided or reduce the need to transport patients to certain locations that have these devices, but rather be able to take it to the patient, to do these types of procedures, to do these types of scans in the patient's room or somewhere like that. So as technology gets better and better, there are these types of things that could be used to make the process more efficient and make it more easier and aid in clinical decision making. So there we looked at different aspects where information technology integrated into the healthcare system, even beyond having a centralized electronic medical record system, a patient record system. These are more practical applications of information technology in healthcare. So looking at the importance, hospitals, CIOs, the Chief Information Officers, have indicated that the health information technology systems help streamline the administrative process in organizations. There is a substantial cost investment involved with it. That is why even government programs help fund some of these types of transitions, but they understand this is a long-term investment. So ultimately, it's going to be very cost efficient. Even nurse managers, clinical staffs have shown how these types of health information technologies have helped reduce medical errors by providing certain information like expert systems where they would speak into drug-drug interaction, check on dosage, make sure that the guidelines are followed properly. And it also indicates that having electronic patient data ultimately contributes to more efficient and effective clinical decision making. So this is where healthcare system delivery is going towards, where it's going away from a paper-based system to an electronic system where everything is centralized, more integrated decisions can be made, patient records could be pulled up even from different hospitals, different institutions, and make it more easy to make more informed medical provision. So some final thoughts. Major issues with IT in healthcare is going to be able to try to have this central database. How can you store this information, making sure of patient privacy? That is why there were different depositories or repositories that were established to try to keep this data and then have networks that could connect and use the data. This could be geographic area specific, or it could be more centralized databases. This help communication between different systems and help in medical decision making. So overall, using electronic health records nationwide have expanded the success of telemedicine and the use of remote medicine and its aspect, because now you have patient information that could be used to make clinical decisions. So overall, it is said that using information technology in healthcare systems will ultimately be cost saving and increase access to healthcare services.